best practices, okay? Because like Laura was asking, well, what about when, the putting an air bolus in there to hear it? We used to do that, and we would still find that patients were having the end of the tube basically in their lungs and things. So it causes problems because then if we're hooking that up to tube feeding, now we're just putting water or tube feeding directly into their lungs, okay? So this is just for your fun knowledge. Not going to be, well, let's say you're going to be tested on it, but keep those in mind. Now, brain fart. Oh my God, what is wrong with me this week?
Coffee?
Yeah, I need to get some more. All right, I have a couple other handouts here for you as well. One is the different lab tests that we monitor to make sure that a patient is getting the nutrients that they are supposed to. Let me grab one for me just for Sean.
Yes.
I'll give you one.
Don't drop. Don't do that.
I'm Chihuahua. Now, I do want to point out that there is a shape on here that might be offensive. That is not a swastika. Okay, let me just point that out. This is a symbol, a religious symbol for an offshoot of it's like a Tibetan symbol, okay? And it has to do with a religion called Jainism, which of course is in the East. But all of these are religious symbols, okay? We're most familiar here in the United States. We're most familiar with Christian symbols and of course the Star of David. But we might encounter all of these different symbols based off of our patient's religion, okay? If they're wearing a charm or anything on their body with that symbol, please be aware and don't touch it. Some religions believe that it's embodied with power to help that person. And, I think it's going around. So if you touch it and you're not of that belief, it would be detrimental for that family. Now, world religions, food practices, and restrictions. I wouldn't say you need to know all of these, but a couple of them for sure. What do we typically have a lot of here in Arizona? Mormons and Christians, okay? We have to be very cognizant of what their standard practices is. Now, a lot of these are fairly, I don't want to say stereotypical, but are the most common. They might not fit every stake of Mormon, because there's stakes and then there's, wards within the Mormon system of how they divvy up people. So, I don't know a lot about Mormons. The ones I grew up with were very standoffish and only associated with other Mormons. But when I've gone, when I taught this type of stuff at the high school, which was in the, literally the new Mormon temple was down the street. A lot of my students corrected me on a lot of things. But on here under Mormon, it talks about, alcohol and beverages containing caffeine are prohibited. And yes, that is so, but apparently the Mormon church has gotten a little bit more lax with that. So as long as it's not coffee or a hot caffeinated beverage, so like Diet Coke, you'll see a lot of Mormon nurses drinking Diet Coke, on end. That's okay as long as the main thing is what us as Americans have a very difficult time with is moderation. You got it, okay? And then, let's see, we have Judaism, so pork, shellfish is prohibited. I have not seen a lot of Jewish religious-based people here in Arizona, but I'm sure, not like New York.
Yeah.
New York, there's a lot of Jewish people there. And even the more strict, where they have the I call them the curls, but I know that's not payasses.
I asked one person about it because I knew they were cool. And they were wearing them. I'm like, did you grow your hair like that? And he goes, no, they're clip-ons.
Well, I will say, Jewish women typically will wear wigs as to keep their head covered. They might still have hair, but they have the wig to keep their head covered and not look like they have the covering. So, let's see. Oh, Islam, pork, and certain birds are prohibited. They might even practice a thing called halal, where the food has to be prepared a certain way. The animal has to be butchered with no pain or discomfort or anything like that. So be aware of those different things. And this comes into play even with medications, because we have some medications that are derived from either pork or beef. Like our insulin products that we used to have back in the 90s was more pork and beef derived. Nowadays we have synthetic insulin that's manufactured in a lab and that's safe to use across with everybody. But we still have some medications like heparin that is derived from porcine. So if you had a patient who was Islamic and had an order for heparin, you probably might want to be like, well, this is pork, you know. I had a situation with that. My charge nurse just told me, well, don't say anything. And I'm like, no. So I was labeled the one that made a big deal out of nothing, but it's not on my conscience. The other handout I have for you guys is the lab tests regarding nutrition. Now, a couple of them on there are highlighted. These are the ones that we really need to know for now with this section. You do need to know too about albumin. I did not highlight that. I thought I did, but I apparently did not. So serum albumin and prealbumin, those are both testing for protein. If they are low, then they have a protein deficiency of some sort. Maybe they're not getting enough protein. The electrolytes, sodium, potassium, calcium. We're also going to learn about magnesium in the coming weeks. That's not on here. And then of course the fasting blood sugar. What I want you guys to do though is look up what those quote unquote normal ranges are next to them, okay? And go with what is in your textbook, because that's what you'll be tested against, okay? I think, what time is it? Oh my god, it's only 9:30? Wow.
Sounds like no crash.
Right. Well, I will say, you guys are a little bit further along, mainly because the ATI thing wasn't working. Surprise! But the lab is open for you guys to be going through and practicing your NG placement. If you have checkoffs for this afternoon that you want to practice, the lab is yours. Okay. Know that next week we are going to be going over more nutrition stuff. This is a 2-week module as far as that's concerned in lab. We'll be going over the different types of diets and restrictions and all that fun stuff. And when I talk about diets, we're not talking about South Beach, Atkins, keto, all that fun stuff. We're talking mechanical soft, full liquids, thin liquids, all that fun stuff. Okay? Alrighty. Alright. I will be here.